Hey everyone, and welcome to RUBIN'S Mind Lab, where we break down the latest research into what it really means. Ever wonder why some health advice just doesn't seem to stick, especially when it comes to things like heart health for Black Americans? Well, this new study dives deep into a really complex and important question. Imagine you are at the doctor's office trying to get advice on how to stay healthy, especially for something as serious as heart disease. You might hear health messages talking about race and health, but how we talk about race in healthcare and even in public health messages can have a big impact. This research asks if those messages and even subtle interactions with doctors can affect a person's confidence in their ability to make healthy changes, and if those changes are something they feel ready to tackle. The big idea here is about something called racial microaggressions. These are those small, often unintentional, but cumulative insults or slights that people of color, especially Black Americans, can experience. When these happen in a doctor's office, they can really mess with how someone feels about their own health and their motivation to change their habits. The researchers also looked at how people think about race itself, whether they see it as something biological or something social. Okay, so how did they figure this all out? They did 2 big studies and used a mix of methods. First, they showed a group of Black adults different health messages about stroke. These messages varied in how much they talked about race and health. Some had no mention of race, some hinted at it, and some were more direct in linking race to health risks. Think of it like a spectrum from no racial talk to a vague connection to a more explicit connection. In the first study, they had over 370 Black American adults participate. They all looked at these health messages. Then, they asked them questions about their confidence in making healthy changes, like exercising more or managing their weight. They also asked about their past experiences with racial microaggressions in medical settings. Did they feel like they were treated differently based on their race by doctors or nurses? The second study was similar but added another layer. They included over 580 Black American adults and also looked at how people's personal beliefs about race played a role. Specifically, they wanted to know if believing race is something biological or genetic, and also believing it is a social or political construct together influenced how people felt about their health behaviors. Now for the findings, here is the surprising part, the actual health messages themselves. The ones that varied in how they talked about race didn't seem to change how confident people felt or how ready they were to make changes. That is interesting, right? But here is where it gets impactful. Experiencing racial microaggressions in medical settings, even subtle ones, really did seem to make a difference. In both studies, these experiences were linked to people feeling less confident about making health changes. In the first study, these microaggressions also lowered people's general self-efficacy, which is that overall belief in their ability to handle challenges. So, the direct messages from the ads didn't make waves, but the participants' own experiences in the doctor's office did. People who reported more racial microaggressions in their medical visits felt less sure of themselves when it came to health behaviors. This suggests that those cumulative experiences, those little digs, have a real effect on a person's motivation and belief in their ability to be healthy. Study 2 brought in an even more complex idea. They found that how people thought about race itself mattered, but only when viewed together. Believing race is biological or genetic wasn't harmful or helpful on its own. But when people also strongly believed that race is a social and political thing, then believing in the biological aspect actually seemed to boost their self-efficacy and their readiness to make healthy choices. It's like having both perspectives together created a kind of protective layer. To get a better grasp on all this, they also looked at what people wrote in their own words after the studies. They analyzed over 50 responses from participants describing their experiences with healthcare providers. Some common themes popped up like race is risk for disease, where people felt like their race was automatically linked to certain health problems without much explanation. Another big one was racist health professionals, where people described direct discrimination or devaluation. Others talked about stereotypes about Black people, a general lack of trust in the medical system, and how body size was often a focal point, sometimes combined with racial assumptions. This qualitative data really helps paint a picture of the lived experiences behind the numbers. One participant said, "I have high blood pressure and I am overweight, which could cause additional problems such as an increased risk of heart disease, etc. For Blacks, these issues do tend to run higher, so I already know I am at an increased risk because of my racial demographics." That is not something that the doctors point out as a charged statement. It is simply based on solid research and evidence. This quote perfectly captures how a racialized, possibly essentialist, idea can be absorbed as fact, even without a doctor explicitly stating it negatively. So, bringing it all together, this research tells us a few key things. First, how health information is presented directly like in a PSA might not be the biggest factor. The real impact comes from the cumulative experience of racial microaggressions in clinical settings. These subtle but persistent slights chip away at the person's belief in their ability to change and their readiness to do so, which are crucial for things like heart health. And that idea about how people view race, it is super important. When people understand race as both a biological reality and crucially as a social and political construct, it seems to buffer the negative effects of those microaggressions. It is like having a more nuanced understanding of race helps you reject the harmful, essentialist ideas that often underlie those microaggressions. When race is seen only as biological, it doesn't seem to offer that same protection, and can even feel like the old John Henryism idea, where people have to put in extra effort against systemic odds, which can itself be stressful. Now, it is always good to think about what this study can tell us. For instance, the health messages used in the study were just brief exposures. In real life, people experience health messages and clinical interactions over a long time, so the short-term effect of a single message might not show the full picture. Also, they use single questions to measure beliefs about race, which is simple but might not capture all the nuances of someone's complex views. What does this mean for the future? The author suggests that instead of just telling people about health risks, we need to be more explicit about why certain racial groups might face higher risks. This means explaining the social and historical reasons, the structural inequalities, rather than implying it is just a biological fate. Doctors and public health campaigns should actively name the social and political construction of race as it relates to health to help patients better understand and reject harmful essentialist premises. This research really highlights that the conversation about race and health needs to move beyond biology. It's about understanding the deep roots of racial disparities in the social and political systems that shape people's lives. It's a call to action for healthcare providers and public health communicators to be more mindful of how they talk about race and to actively challenge the idea that race is a simple biological determinant of disease. To sum it up, the way we talk about race in health matters, and experiences of microaggressions can really undermine someone's motivation to be healthy. By understanding race as a social construct and being more explicit about the why behind health disparities, we can hopefully empower individuals and work towards closing those health gaps. What are your thoughts on this? Have you ever felt like your race impacted the health advice you received? Let me know in the comments below. And if you found this breakdown interesting, give this video a thumbs up, subscribe to RUBIN'S Mind Lab for more science insights, and hit that notification bell so you don't miss our next dive into the world of psychology and human behavior. Thanks for watching.